Good afternoon. My name is Jennifer Hale. I'm the Infection Control Manager for Mitchell County Hospital, and I'm joined by Dr. Dee Roach, our Medical Director today. We wanted to come to you guys as our community and just give you a little update on where we stand with our COVID cases. We are seeing an increase in numbers at our facility, locally in our surrounding areas. We're seeing people come in daily symptomatic and needing a COVID test, and we're seeing those positive results come. So we do need to practice those precautions that have already been in place, that we have been doing, and we just need to make sure that we're continuing to do those. That includes hand washing, disinfecting high-touch surface areas, wearing your mask in big crowded areas especially. Since school is starting, we're going to have larger crowds of people, so make sure we're taking those precautions. We do have testing availability here, which is drive-through testing. If you have an established provider here with us, you would just need to call and talk with myself or my coworker and to get that set up. If you don't have a provider here with us, or if you would prefer to see the doctor, then we can make sure that you get an appointment to do that as well. If you have any questions about COVID, you can also reach out to us. The way you can reach us is through our COVID hotline, and the number is 728-3431, extension 7070. Just leave a message if we don't answer, and we will get back to you as soon as we can. Our phone lines are currently still down due to an AT&T outage. I know they're working as quickly as they can to get that up and going. So just continue trying that number until you can get through if you have questions about COVID testing or just COVID questions, period. Also, I want to talk about COVID vaccines. We are having vaccine clinics every 2 to 3 weeks. If you just will look for information on Facebook or in the Colorado Record, maybe on the radio for announcements of dates and times of that. Right now, if you want a COVID vaccine sooner than what we are able to offer it to you, you can check in surrounding areas. There is COVID vaccines available, all different types. You can check with United, CVS, Walgreens. The Nolan County Health Department has a COVID vaccine clinic every Thursday. So the vaccine is available even if we don't have a vaccine clinic at the time that suits your need the most. So please feel free to reach out to ask those questions or reach out to those different areas to get your vaccine. I'm going to pass it over to Dr. Roach now.
Okay. Well, Jennifer, you're right. We have seen an increase in the number of positive cases here in our county, which is not a big surprise considering the increased rate of occurrence of positives throughout the state and nation. And I think the pattern that we're seeing is pretty consistent now with the pattern that we originally had. With higher population densities, we saw the resurgence of the coronavirus, particularly in the urban areas, suburban areas, and so we're a bit insulated being out here in rural areas, but certainly with our travel opportunities and mobile society, it was only a matter of time before we start seeing the recurrence once again. A lot of discussion now about the Delta variant of the coronavirus. The study just released today showed that 93% of COVID infections today are due to the Delta variant. So I think it's easy to presume that if you do have COVID, you probably have the Delta variant. That's a good news, bad news situation with the Delta variant. It is more transmissible, more contagious than the previous strain of coronavirus, which means the likelihood of you getting it is greater. But the good news is that the symptoms have typically been less severe, shorter duration, and so the probability of people getting truly critically ill is less probable with the Delta variant as compared to the original strain that we've seen in that in our past. The statistics of people who are contracting the disease in the vaccinated versus unvaccinated population, pretty impressive. The most recent data shows that 95% of all people who are contracting coronavirus today are in the unvaccinated population. 93% of all hospitalizations with coronavirus are currently in the unvaccinated population. So, I think that speaks volumes for the coronavirus vaccine itself. We encourage the vaccine, or at least we encourage you to consider having the vaccine. I know people are concerned about its safety and the fact that it has been out only for a short period of time. Locally, statewide, nationwide, we're actually seeing a very low rate of complications related to the vaccine, and its effectiveness is pretty self-evident. People are reporting having contracted the coronavirus even after vaccine. The majority of those are in fact the Delta variant. But even in the vaccinated population, we're seeing that it is effective against most of the Delta variants. And even if you do contract it after vaccination, then the disease is much shorter lived and less severe with its symptoms. So all in all, we want to reinforce to you that coronavirus is alive and well in Mitchell County, and we ask you to take appropriate precautions, as Jennifer has mentioned to you. Make sure that when you have opportunity that you do exercise social distancing, hand washing techniques, covering your cough as always. Despite the state's posture with regard to mask wearing, we at Mitchell County Hospital still encourage you to wear your mask. It has been proven effective, proof positive in fact, because last year we had 0 confirmed cases of influenza, and that's 100% attributable to the masks that we were wearing at that time. So the masks work. We encourage you to use them if you are at risk. If you know that you're going to be in a population dense circumstance, such as a family reunion, funeral, wedding, whatever it might be, we still encourage those at risk to make sure you wear your mask. The hotline is open. Any questions that you might have regarding to the vaccine itself or clinics, we'd encourage you to call. Be safe.
Thank you.